Good morning. This is Faith in Our Hometown, brought to you as a community service and sponsored by Mercy Hospital, Joplin. And now, here's your host, Father Jay Friedel.
Good morning and welcome back to Faith in Our Hometown. I hope you're having a wonderful Sunday morning. Today on Faith in Our Hometown, we're going to be talking to Stephanie Brady, who is the Executive Director of the Community Clinic in downtown Joplin, just kind of right around the corner from where I am. So welcome, Stephanie.
Thank you.
We're going to be talking a little bit about what Community Clinic does. We found through our doing the show that there's so many different entities here in Joplin and the greater Joplin area that people don't even know what they're about. They drive past them all the time, and Community Clinic is certainly one of those. So this morning we're going to clear up that mystery about what happens there at Community Clinic and what we do as a community to help some of those folks who might fall through the cracks in terms of health care if a place like Community Clinic weren't around. So please stay tuned. We're going to be right back after this Mercy Minute. So stick around and we'll be right back with Stephanie Brady in just a few moments. Thanks for joining us this morning. Stay tuned.
From childhood, whenever I was about 12, I would say, my weight really started climbing and it never really plateaued. I've tried low-carb diets, high-protein diets. I've tried calorie diets. It's very important to Dr. Lou that this is a team effort, so a primary care doctor following up with me regularly, and the dietitian was very helpful on providing recipes and helpful information to help me be successful in my journey. I am very active and I play sports with the kids. We like to go play volleyball. I've done some warrior dashes.
So welcome back again to Faith in Our Hometown. As I said before the break, our guest this morning is Stephanie Brady, who's the Executive Director at Community Clinic here in downtown Joplin. So Stephanie, why don't you tell us first a little bit about yourself, and then let's talk a little bit about Community Clinic.
Sure, thanks for having me on today. I've been a Joplin area resident for most of my life. I grew up in Carl Junction and went to Missouri Southern, left for a little while and came back about 15 years ago and was with the Independent Living Center until about a year ago whenever I went to the Community Clinic.
Great. So you've done a little not-for-profit work through the years?
Yes.
Yeah.
I've been focused on not-for-profit for quite some time. I got my graduate degree at KU in urban planning and community development. And since that time, I've been really passionate about helping people in our community. And moving back to this area, I really wanted to give back, and I wanted to help do some different things to make sure that the people that we see in our community have the resources that they need.
Well, I do know that there are some folks in our neighborhood, and from a larger area as well, that sometimes fall through the cracks for whatever reason. And that's one of the reasons I understand the Community Clinic is there, is to make sure that we're taking care of some of the health needs of some of the folks who might otherwise get missed.
Exactly. Our mission at the Community Clinic is to serve the needs of the uninsured residents of Southwest Missouri through health care and dental care. We actually see about 7,000 patients a year, actually about 2,500 patients, about 7,000 visits every year of individuals who have no health care insurance and are really falling through the cracks. About 85% of the patients that we see are the working poor. They make too much money for Missouri Medicaid, but they can't quite swing Affordable Care Act or marketplace insurance. So those are the majority of the people that we see. They really do fall through the health care cracks. And if it weren't for the services offered at the clinic, they really wouldn't have access to health care.
So let's clarify that. Let's talk about that for a second. A lot of the folks that you see are actually folks who have jobs and all those kinds of things.
Right.
So we're not talking about folks who are living on the street, although you probably have some of those too.
Right. About 10% of the patients that we see are going to be homeless or may have chronic mental health issues, may be afraid of the system and haven't been able to access the system. But the majority really are the working poor. They're making ends meet as best they can. They might be working a part-time job or might not be able to, even if they're working a full-time job, they don't have access to the health care or insurance.
Right. And I think that that's one of those things I think that a lot of people don't understand is that, that a lot of people who actually are working, especially if it's a minimum wage job, even if they're working full time, might not necessarily have health benefits or those kinds of things, or be able to afford them in a different way.
Exactly, and that's, we see people who are also kind of considered the uninsured. They might have Missouri Medicaid, but they're not covered for their dental care, or they might have some veteran benefits that don't cover for all the different cares that they need. So on very small pockets of individuals might qualify for other services from us as well. But we see so many people who are really working hard to make ends meet, and they just haven't been able to get there. An example, we had an elderly gentleman who had worked his whole life but never really got ahead, and he was on Medicare and needed some dental care that wasn't covered, and he came in and was able to receive care from the clinic. We were able to pull the teeth that he needed, and while we're the free clinic, we don't require anybody to make any payments to us for the services that we provide. We do ask for donations if people are able to do that. And this gentleman said, I don't have the money to give you a donation, but I'm a gospel singer. So for an entire week, he would dress up every day, and he came into the clinic and he would sing gospel music in our lobby for the other patients as his way of giving back.
Sure.
So, we have people, whenever I took the job at the clinic, a lot of people thought that everybody who we saw were only the homeless.
Right, yeah,
and
exactly.
that you had to, we only saw the poorest of the poor. And that is a component of who we see. But we also see so many people who are just having difficulty making ends meet. We see people who are, who've been working a job, but they became laid off and they aren't eligible for insurance for a few months, or they're trying to get ahead in other ways. So we're that kind of that safety net for a lot of different populations.
Right, and I think that safety net idea is one that I think kind of eludes a lot of people, because they're just like, well, why would somebody fall through the cracks? I think sometimes for those of us, I've never worried about being uninsured. My family always had medical insurance for me, and then I was ordained, and of course the church provides medical insurance for me now, and dental and all that kind of good stuff. I've never had to worry about that. But I do know that when I see those bills, and then I see what we were charged for this, that, or the other thing, for my health care, and I'm relatively healthy, but, so I don't go to the doctor a lot, but even those 4 visits a year, 2 to my endocrinologist, 2 to my regular, some of that stuff just adds up. And when I look at the amounts and then with the amounts in Medicare, I'm just like, wow, I've never had to worry about that, but a lot of people do.
They do. And another good example, we had a single mom who had 3 children, and they had recently moved to Missouri from another state. Her insurance wasn't, she wasn't eligible yet for Missouri Medicaid, and she was going to school, trying to better herself while she was also trying to work part-time and take care of her 3 children. And she came in one day and had gone to urgent care. She had all 3 kids had tested positive for flu, and the prescription for one of those children was going to be $300, and she was just in tears. How was she going to be able to do that times 3 plus herself while she's trying to go to school and work part-time? And that's just another example of the reasons that we do what we do. They were able to come to the clinic, they were able to be seen by a pediatrician at no cost, and we were able to provide them with the prescription that was able to get them healthy, get her back to work, get the kids back to school, and take some of that stress away from her.
So where does Community Clinic get its money?
We are a completely independent nonprofit. We don't receive any federal or state funding, and that's something that we've focused on from the beginning, that our board and our founding board really wanted us to be independent. We receive grant money, we'd receive private donations. We also have agreements with both hospitals because we do reduce the number of patients that go into their emergency rooms.
Sure.
We have several benefactors in town that really like what we do and they want to contribute, but we also have patients who make donations. So even though we don't require it, we receive several $100s every month just in patient donations as well.
Sure, because they can pay something, but they wouldn't be able to necessarily pay.
Right.
And again, those are the kind of people who they're really not looking for a handout. They wouldn't be there if they didn't have to be.
Right.
And especially for their kids.
Right.
Parents suffer so much when they watch their kids, in trouble or in distress or sick.
Right.
And so, yeah, I can see that. So mostly private donors, okay, but no federal or state money.
No federal or state fund.
Do you do much grants or any of those kinds of
We
things?
do receive grants, and a lot of those are private foundations. Some community type of foundations. We've received grants from local community organizations as well, and a lot of churches. We have church groups. A Sunday school class that will have give to us every single month. And that has helped a lot as well. And then probably one of our largest contributions is through our volunteers. We have 11 paid staff members, and they're all part-time. But almost all of our actual medical practitioners are volunteers.
Are volunteers, yeah.
So we have about 15 volunteer doctors, 4 dentists, a pharmacist, chiropractors, and a mental health provider as well.
Wonderful. So these folks will find you some way, somehow. I imagine they get referred from some of the other areas. When they find out they can't pay, they'll refer to you, or
Correct.
Yeah.
There's a variety of ways. They can just come in our doors. We do allow for walk-in sick visits. They can call us and ask for assistance, and they can come in that way, or we can accept referrals outside as well.
Yeah. So you say you saw 7,000 people, 7,000 visits last year, but about 2,500 people.
Correct.
Hey, do you guys make some kind of a guess as to what that would have cost had they gone through the regular system?
Each visit would cost about $500 through the regular system, and we have it down to where it's about $50 that it costs us per visit. So we've worked really hard to ensure that we're able to provide good quality care at a low cost for the clinic and our donors. But we, in terms of volunteer hours, it's about $350,000 of medical staff volunteer every year.
So if they were getting paid,
right,
that's what that means. So in other words, if they were punching the clock somewhere else,
exactly,
that's what it would cost. So that's about $350,000 in donated services.
Right, just on our medical staff volunteers, and then we have, office volunteers and all kinds of different volunteers that come in as well.
Yeah. So you've got 11 paid staff. Now, who are the paid staff? Just so that everybody get a full picture of what's going on down there.
Sure. We have a part-time nurse practitioner, and we have 2 part-time RNs. We also have our own pharmacy, our dispensary, and we have a part-time a pharmacy tech. We have somebody who does our lab work as part-time. We have our own in-house lab that we're able to do a lot of different things with. One of the issues for a lot of the people that we see is that they have transportation issues, or they may have had to take off work to come to the clinic. So we try to do as many things in that one visit as possible.
Sure.
So they can come and they can see the medical staff. They can have their labs taken care of for the most part in the house, and they can get their prescription all before they leave the clinic. So that's how we have the pharmacy staff, and we have the lab staff. We also have a couple of staff up front. The front desk office, and we have a patient advocate as well.
Yeah. Well, it's amazing how many people it actually takes to get all this stuff done. And I'm sure a lot of the trick there is the coordination between the folks you actually have working there and, of course, your volunteer staff that goes with it.
Correct.
Well, we're talking to Stephanie Brady, who's the executive director of the community clinic, which is basically right down on 7th Street. 7th and
Joplin.
Joplin, yeah. And I probably drive past there at least 2 or 3 times a day. But it's always good in a show like this for us to take a look inside. So we're going to be taking a little bit more of a look inside when we come back. We'll talk a little bit more about community clinic, but we're going to be back in just after a short break, and this is Faith in Our Hometown. So stick around.
You're watching Faith in Our Hometown on KSN TV, brought to you as a community service and sponsored by Mercy Hospital, Joplin.
So welcome back once again, Stephanie Brady, Community Clinic. So Stephanie, you've been there for about a year, you said?
It's almost a year.
Okay. How long has Community Clinic been in existence?
23 years.
23 years.
We started as an outreach program in the basement of the First Presbyterian Church downtown.
Okay.
And grew. At that time, we were a 1 night a week, every Thursday night, only volunteer clinic. and it quickly grew the outgrew the capacity. So then we, about 15 years ago, we moved to where we are on 7th and Joplin, and have grown and grown since then.
And you've recently done some work there because obviously changing needs, those kinds of things. So what kind of work did you all do recently?
And we had a grant for some remodeling work, and the building itself hadn't been significantly remodeled in quite some time. We had 3 different kinds of flooring just in our lobby. I had been a candy striper at the old St. John's, and the furniture in the lobby was the same as whenever I volunteered as a candy striper 30 years prior, and it was donated about 20 years ago.
Yeah.
So we needed a lot of freshening up, and we needed to improve some areas for safety as well as privacy. So we restructured some areas in the clinic. Whenever you come in now, it's very positive and bright. We've had patients come in who say, I don't feel like I'm going to the free clinic anymore. I feel like I'm going to a regular doctor's office. And it really has improved the morale of the patients, but also of the staff and the volunteers.
Sure. And again, statements like that get made, just basically to compliment what you've done rather than to say, I was staying away because, no, it's one of those things they were going to go because they needed it, but now when they walk in, they're just like, oh, wow.
Yeah.
This looks nice.
It has a different feel, and we have one of our doctors who is our diabetic specialist is also a photographer. So he donated about 10 pieces of his photography that we printed and are up on the wall. So it's a very inviting environment now.
Yeah. So with all of the changes there, and with changes that could be happening in the healthcare scene, do you think that you're going to wind up with a whole lot more business into the future?
I think that we already are starting to see people who are fearful of what's going to be going on, who are calling us saying, "Are you available if I lose my insurance? Are you going to be able to be there if I don't have access to health care any longer?" And that's something that we assure people that we are here. We are going to be your option for health care, and we want to make sure that they know that they feel welcome. But I'm fairly confident that we're probably going to be seeing some increases in our roles in the near future.
Yeah, and so if folks wanted to help or do those kinds of things, what would they what could they do to help you at this point in time? If that's a concern of theirs, if that's on their giving profile or those kinds of things, how would they help you?
There's a variety of ways. They can either become a financial donor if they would like, and basically they would just notify us that they're interested in that, and we take one-time donations, or if somebody wants that to become part of their monthly giving, we're able to do that as well. We take in-kind donations. We regularly need office supplies, we need health care supplies, and we receive a lot of those types of donations as well. And volunteering. Volunteering is one of our biggest areas, and especially medical professionals. We even recently gained a volunteer who does medical transcription, who had recently retired and said, I really miss doing medical transcription, which that's her focus. So we were excited to have her come in and do that for us. So basically we have a Facebook page and we have our website, and they can also call and talk with me directly, and I can give them an idea of some of the things that we have available.
So real quick, while we're on the subject, just why don't you give them the website address and your phone number, and then that way they can have it.
Sure. Our website is www.joplinclinic.org, and our phone number is 417-624-5500.
Okay, let's do that one more time.
www.joplinclinic.org and 417-624-5500.
Okay, so obviously you'll take all kinds of assistance, whether it be monetary or even folks that didn't even know this existed and might have some of those skills.
Exactly.
They can come in and do that. So tell us a little bit about it. Let's put a face on this, because I think that's one of the things that I think always helps people to understand what's going on. What was one of those issues? What was one of those situations in the last few weeks that because you were there, you know the difference was made, and that somebody's life was really improved, the quality of their life was improved because you guys are in existence, because community clinic is there.
We have a really great example of a man who has diabetes, and he was wasting away and did not realize that he had an option of coming to the clinic. He had worked his whole life, was a hard worker, and was a family man, and really just didn't realize that he could access our care. His wife confided with me that he had given up and was ready to die. And this is somebody who is a very faithful person and very involved in the community. And she convinced him to come to the clinic. And we have a kind of a wraparound services for something like that. We have our diabetic specialist, but we also have diabetic nutritionists that work one-on-one with patients and help them to learn more about how diabetes affects them and how nutrition and exercise impact them. So he started with our diabetic specialist, who got him on the insulin that he needed, and we were able to provide the insulin for him through our prescription assistance program, so that didn't cost him anything. And then he was able to access the diabetic nutritionist and mental health provider through that. And bringing all of that together, he has since gained 15 pounds, which is very, very good. His wife says that he actually has a positive outlook and he's excited about life again. He felt like he was a burden to his family. He felt like he was causing his family to have a lot of other issues. And now that his health has gotten better and he sees the light at the end of the tunnel, he really believes that he's doing, that he is a contributing factor to his family again. So that was a really great example of one individual who has this wonderful large family and all these additional factors that come into that, how the clinic really impacted him. And he says, and his wife says, if it weren't for this clinic, if it weren't for the intervention from these practitioners, he wouldn't be here today. So it's there's a lot of those. Those are the days whenever you know that you're doing the right thing and you're excited about helping others. And every day is a good day, but whenever you see that impact of somebody and you see how their life has changed because of the work you do, it is very satisfying.
Yeah. Do you find yourself in an advocacy role very much? I mean, in terms of even sometimes people thinking that they can't unlock services somewhere else, but get the opportunity to do that. Do you help people navigate through some of those things?
Quite a lot, and that's part of whenever we started a few years ago with a patient advocate position, because we were doing so much advocacy that we really needed a dedicated person to be able to do that. Another good example is a gentleman who had been 9 years living homeless and chronic mental health issues and that were unmedicated. And he was terrified and fearful of the system, but he started coming into the clinic. We're also a warming and a cooling site. He started coming into the clinic over the winter just to come in and get a cup of coffee, get warm, and at first he wouldn't make eye contact with anybody. After a few weeks, he started feeling more comfortable, and we were able to get him into mental health counseling, get him stabilized on medication, and started the process for him for housing. And seeing his transformation from somebody who wouldn't make eye contact with us to somebody who's starting to get excited because he might get a home is very impactful as well.
Yeah. It's interesting being in the neighborhood. I think I might even know who you mean. And it has been a remarkable transformation, in some of those lives who, we get to interact with, which I think is amazing. And that's another thing I don't think a lot of people really truly understand is, really we don't have a whole lot for folks in terms of mental health.
Right.
If you're not on traditional insurance and don't have a strong caring network around you to help intervene and pack you off to see somebody when things go wrong.
Exactly.
And it's always amazing when you can build enough relationships over the course of time that somebody will trust you enough to let you make that kind of an impact in their lives. It's pretty amazing.
And this is a gentleman who, once he started to get some stabilization, he really has a lot to offer. And he just, whenever you're in that situation and you're so deep into it, it's sometimes hard to see.
Sure.
So.
And I think it's so. I think it's so important for us to give hope to folks who might struggle otherwise, or, I've just heard way too many horror stories over the years that, everything was, people were living paycheck to paycheck and they were making it work and everything was fine, and then one illness where the person couldn't go to work and just could not work because of the illness. Then all of a sudden no income coming in. Then all of a sudden with no income, then wind up, not being able to pay rent, not being able to pay bills, to do those kinds of things. And then all of a sudden, on the streets. And again, how stressful that is. That will send people, I know it would certainly send me into depression and despair. If suddenly I had worked, everything I'd worked so hard for in my life was suddenly, just in crumbles around my feet. So again, one of the great hopes that you can give people is to know that there's a place.
Exactly.
And that's a wonderful thing. So, Steffi, I just want to thank, on behalf of the community, I want to thank you again for the work that you do. I think it's wonderful, you and your staff, and of course all your volunteers, trying to make sure that those folks that might otherwise fall through the cracks are getting a little bit of TLC from somebody, and even especially even in our own neighborhood, that downtown area. Downtowns are interesting places, aren't they?
They are. I love being downtown.
It is.
It's always something different.
Some days I shake my head and go, it's just like, what am I doing downtown? But other days I'm just kind of like, I'm grateful I'm there. I'm grateful that we've got so many different groups around the area. Well, we're going to be right back in just after this Mercy Minute. Stay tuned for the closing for Faith in Our Hometown.
Find out how a Mercy doctor can take care of you. At Mercy, your life is our life's work. Quality, safety, and an exceptional patient experience. Mercy is grateful to be recognized as one of the top 15 health systems in the United States. At Mercy, your life is our life's work.
Well, if you're like me, you travel certain routes through the city each and every day. And there are those routes that you pass by buildings and you see names on signs and you have no idea what they do there. And one of those that I think for probably much of the larger part of the community would be Community Clinic, which is at 7th and Joplin. That building there, as we've been talking with Stephanie Brady, who's the executive director, is there to help some of those folks who might fall through the cracks, especially in terms of medical or dental care. We do have a lot of working poor here in the area. We got a lot of folks who work really, really hard, but because they don't make enough money, they wind up sometimes not being able to afford all the things that they need. And that's especially true even in terms of healthcare. So thankfully, many years ago, the community clinic put together a board and tried to figure out how to meet those needs. And we're blessed in our community. The community clinic is still there meeting those needs today. Again, if you're interested in joining them in that type of ministry, please get in contact with them. But let's all of us continue to look out for each other here in our area. This is Faith in Our Hometown. You have a blessed week.
Thanks for watching. Faith in Our Hometown can be seen Sunday mornings at 6:30 and 9 a.m. on KSN. Brought to you as a community service and sponsored by Mercy Hospital, Joplin.